The medical community comes together on October 21st, and you are invited to the event as well, because it's time once again for Denim and Diamonds. Kevin Lusk joins us. He is with the Medical Foundation of Chattanooga. Good to see you.
Thanks for having me.
Great to have you. So, you know, this is one of those times where I always am glad when you're here to talk about Denim and Diamonds, because it's not just one thing. So it's a great fun night.
Right.
I think you theme it up every year.
What's
this year's theme?
It's just we're going back to our roots. It's just Denim and Diamonds.
Okay.
You know, we had it going for several years. Pandemic happened, so we kind of had a chance to sit down and reevaluate what we were doing. And last year we did Glow, which was kind of our Glow party, and we had folks come back and ask us, what happened to Denim and Diamonds? So we're bringing it back, and we're just going back to our roots, call it Denim and Diamonds. So you can come dressed in your jeans, you can come dressed in your ball gowns and tuxedos if you want.
Right.
However you want to come, just come as you are and have a good time.
Come as you are, because the whole purpose of it is it's a fundraiser for the Medical Foundation, because y'all are doing what to give back to those who kind of fall in between the cracks?
Right. Well, we have our flagship programs is Southeast Tennessee Project Access.
Okay.
And in April we'll be celebrating our 20th anniversary.
Okay.
And basically it is our specialized charity care program. So someone falls in that Medicaid gap, they don't have insurance, they may be working, don't have enough money to afford insurance, or don't have a salary where they can afford insurance, or they're at a place that doesn't offer insurance, or they may have gotten laid off recently, they don't have a job, they're trying to get a job again because they have health issues, but they can't because they're dealing with their health issues, they don't have access to insurance. They have a primary care home, their physician, whether it's a community clinic like Volunteers in Medicine or one of the Erlanger community clinics or CHI Memorial's community clinics or Caris in Cleveland, that community clinic will, anything from a broken bone to cancer is what I normally say. So we cover the gamut. If there's a specialized healthcare need, they're referred to us. We make sure they qualify, and we find a specialized care physician that will address all of their healthcare needs at no cost. So they'll go to the physician, they'll be diagnosed. If they have to have surgery, they'll do whatever procedure needs to be done. Our hospital partners and our specialty care partners donate all of that, and they pay nothing. The patient pays nothing.
So, you know, I think there was a time when you went and you got a job and insurance came with it.
Right.
I remember those good old days.
Right.
I even had a time in Indiana and before that where my insurance as the employee was paid.
Right.
It was a very different time. So if you're of that era, you might not understand how easy it can be to be that person who slips in between those cracks. There are people who work hard, but they can't afford the insurance.
That's exactly it. And even with the ACA, the Affordable Care Act, a lot of people think that people automatically have insurance. Well, that's not the case.
Right.
And so that's why we're here. We're here to help those folks that slip through the cracks. We receive a state grant from the Tennessee Department of Health that helps us fund this need, but we also, of course, go above and beyond that grant. So that's what we have fundraisers like Denim and Diamonds to make sure it happens.
You know, we end up talking a lot with different people on this show about preventive things, whether it's home care or health care, whatever. So in this particular case with what really is Project Access, there's been a medical need for a specialist, whether it's an orthopedist or an oncologist or a pulmonologist. Is that basically it?
Exactly.
Okay, so once they're there and now they're getting the care that they need, now they're healthy again.
Right.
And eventually the hope is that they don't have that repetitive need.
That's exactly. We want them to be able to return to work. We want them to be able to become, you know, those members, the productive members of society, where they're actually able to go out, get a job, work their regular hours, and actually be able to spend time with their families. We've had a ton of parents and grandparents say, I wasn't able to spend time with my kids or grandkids because I was sick. And we're able to restore their health to where they were before, and they're able to go out and play with their kids and spend time with their families.
Okay.
And most importantly, get that job back.
Right. Okay, so let's talk about the event. It's October 21st.
Right.
So you come in your jeans or your denim dress, or you come all blinged out,
That's
or
right.
a combination.
Do both.
So are there still some tickets available? Because I know this one can go.
We have a handful. We have about 12 left.
What?
So yeah, we're close to a sellout.
You came to me with 12 tickets
Well,
left.
you know, you can buy all 12 if you want, but no, it's going to be great. We're going to sell this thing out, and it's going to be a lot of fun. We're at Chattanooga Whiskey Hall this year, so a little bit different venue for us, but it brings a lot of fun opportunities, and we're just going to have a good time.
Do you do an auction or anything, or is it just the tickets?
Well, no, we'll have a small silent auction. It'll all be online. We'll have some things on display that people can bid. We'll have some artwork and some trips and things like that. But we're also doing because of the limited space, when we don't, normally we do a huge auction display.
Yeah.
One thing we're doing this year is, with all the generous gift card donations we've got from local restaurants, we're doing a gift card pull. So someone makes a $50 donation, and they'll pull a gift card. It could be worth $50. It could be worth $150.
That's great.
So it's just one of those things that's kind of fun and just adds a little added element to it this year.
I love it. And for the doctors, how much does it mean for them to have the support to be able to do what their passion in life
is? One reason why we do this is, we celebrate them, and in this day and age, a lot of these physicians, a lot of the primary care physicians don't get to see the surgeons because they're not in the hospital together, but they're still working together and collaborating with for the patient's needs, including our Project Access patients. So this is one of those places where the doctor's able to come together and in the healthcare community and see each other where they normally can't fellowship and things like that, and just the general community as well. So the doctors love to see the general community come out and just show that they appreciate what they do, and they see what they're doing, and they're giving back, and this is just one way they can help give back in a fun way. Okay, so here's how you can be part of that fun. If you're one of the people to contact and get one of the 12 tickets left right now, chatmd.org. Is that right?
That's
right.
Can you do that?
They can go there.
It's October 21st. The doors do open at 6 at the Chattanooga Whiskey Event Hall. You can Google Medical Foundation of Chattanooga or Project Access, either one, and see more about what their mission is. But chatmd.org will get you a ticket in.
That'll do it.
Thank you, Kevin.
Thank you, Julie.